Om Dham Dhanvantare Namaha. Ragadirogan Satatanshaktan Asheshakanan Prasatan Sheshan Autsukya Mohan Ridan Jaghana Yopura Vaidya Namaste Tasmai. Let me share. Topic is Jeerakarishta, its clinical indications. These Asavarishtas, they are very commonly used in the treatment of various disorders by Ayurvedic physicians. Especially Jeerakarishta, which is Pittahara, and also it is useful in gastrointestinal disorders like Amla Pitta, gastritis, chronic gastritis, peptic ulcer, duodenal ulcer, gastric ulcer, etc. So Ayurveda medicine is becoming popular in both Indian subcontinent as well as in the whole world. Herbal and herbo-mineral preparation formulations are in use by Ayurveda physicians in general practice. Asavarishta preparations are such type of formulations which are widely used by physicians in both acute as well as chronic disorders. Asavarishtas are easy to prepare and may be stored more than 10 years after the date of preparation with the pharmacological action intact in these formulations. So Jeerakarishta is one such preparation which is commonly used in the management of various GIT disorders: Amla Pitta, hyperacidity syndrome, non-ulcer dyspepsia, Udarashu Daha, Urodaha, abdominal pain, peptic ulcer, etc. can be treated by Jeerakarishta. It is, however, given along with suitable disease-specific adjuvant in these patients. The present paper highlights about the clinical indications of Jeerakarishta in an experiential and scientific view. So Jeerakarishta is Sandhaniya formulation, which is commonly used in the management of GIT disorders. It is Vatapittahara, Shulahara, Dahahara, Tadoshahara, anti-stress and adaptogenic in action. The main ingredient being Jeeraka, that is communim synonym, which is aromatic, and Pittahara in action. It is being Deepana, Pachana, Solahara, Pittahara, and antispasmodic also. It contains essential oil having anti-infective, antibacterial, and bactericidal action also. Jeerakarishta is usually given in Amla Pitta, Urodaha, Udaradaha, Udarashula, Amashaya Pradaha, Parinamashola, Annadrovashola, non-ulcer dyspepsia, hyperacidity syndrome, hyperacidity syndrome, and abdominal pain also. So ingredients of Jeerakarishta are Jeeraka, Caminum simnum, Jaggery, Dataki, Pushpa, Woodfordia fruticosa, Shunti, Gingiber officinale, Yatifala, Myristica fragrans, Musta, Cypress, rotundas, and Twak, Cinnamon, Geranica, Green cardamom, Tejapatra, Caminum seminum, Nagakeshara, Mesoferia, Ajwain, Techispermami, Kankola, and Lavanga, and water. So actually it acts on the duodenum, gastrointestinal tract. In the duodenum, that is soothes the smooth mucous membrane. Actually, in case of duodenal ulcer, there will be increase in high acidity of the stomach, and in the duodenum also the acidic food is coming, food content is coming. So it damages the mucosa and causes discontinuity of the mucosa in duodenal ulcer. Yes, this is the duodenum histology. It's a normal histology. You can see mucosa, submucosa, muscularis externa, and serosa. In the mucosa, there are intestinal glands or crypts of Lebercon, which contains the enzyme secreting cells and mucus secreting cells. And in the submucosa, you can see the Brunner's glands. So this is the stomach body. You can see the gastric pits, the gastric mucosa and gastric pits. Gastric pits, in the gastric pits, chief cells, oxytic cells, and mucus secreting cells are there. So there are 4 layers like mucosa, submucosa, muscularis externa, and serosa, as in other areas of gastrointestinal tract. In gastric ulcer, there will be discontinuation of the mucous membrane because of hyperacidity. So this is our tongue. This is Jeerakarishta increase the taste. Taste is perceived by taste buds. Taste buds are present in the border of circumvallate papillae and fungiform papillae. You can see in the upper area there are papillae which contains taste buds. So Jeerakarishta increases the taste. So ingredients of Jeerakarishta includes Jeeraka, Caminum seminum, Ardraka, Gingiber officinal, it is antihistaminic, Deepana, Pachana, and it is also Amapachaka also. This is a Guda, Jaggery, which is used in preparing the Arishta. And this is Ataki Pushpa, Woodfordia fruticosa. The fruits are dried and used for sandana or fermentation. And this is Jati Phala, mystic of fragrance. The end of the seeds, the fruits, they are dried and they are used. This is Stambhana in action, Shukrastambhaka also. So Mustaka, Cypress tendus, the rhizome is used and it is dried and used. It is Deepana Pachana, aromatic also, and it is soothing action. So let us see the actions of Jeerakarishta, like Deepana, Pachana, Shulahara, Dahahara, Pittahara, Vatahara, soothing action on the mucous membrane, Amlapittanashaka, cytoprotective, antispasmodic, and Malavatan Lomana, and also carminative, anti-stress, adaptogenic, sedative, anxiolytic, CNS depressant, and galactagogue. Now let us see the clinical indications. Clinical indications of Jeerakarishta are Amlapitta, non-ulcer dyspepsia, hyperacidity syndrome, peptic ulcer, duodenal ulcer, gastric ulcer, abdominal pain, to increase the breast milk in postnatal period. Amashaya Pradaha, chronic gastritis, vomiting, nausea, and sore erectation. So with the disease-specific adjuvants, it can be given in various disorders with the better results. Like in Amlapitta, it is given with Pravala Panchamrita Rasa or Mukta Panchamrita Rasa. In ulcer dyspepsia, it is given with Kamaduga Rasa. Non-ulcer dyspepsia, it is used in given with the Kamaduga Rasa and Avipattikara Churna. In hyperacidity syndrome, it is given with Kamaduga Rasa and Avipattikara Churna. In peptic ulcer, it is given with the Avipattikara Churna and Pravala Panchamrita Rasa. In duodenal ulcer, it is given with Pravala Panchamrita and Pravala Pishti. In gastric ulcer, similar medicines are given. In abdominal pain, it is given with Kupilingvadvati and Agantundivati. In decreased breast milk, it is given with the Shatavari Guda or Shatavari Grata. In Amashaya Pradaha, it is given with the Bunimbadi Kada. In chronic gastritis, it is given with the Pravala Pishti and Sutashekara Rasa. In vomiting, it is given with Madhipala Rasayana and Lajamanda. In nausea, similar medications. In sore erectation cases, it is given with the Pravala Panchamrita Rasa. Coming to discussion, Jeerakarishta is a Sandhaniya preparation formulation which is commonly given in gastrointestinal tract disorders. It is Deepana, Pachana, Pittahara, Cholahara, Dahahara, Amlapittanashaka, and galactagogue in action. Galactagogue means which increases the milk secretion in the mothers, lactating mothers. It is commonly given in Amlapitta, Amashaya Pradaha, peptic ulcer, duodenal ulcer, gastric ulcer, hyperacidity syndrome, non-ulcer dyspepsia, and increases the breast milk when given in lactating mother. It is Shitavirya in action. It has soothing action on the gastric mucosa and ulcer protective and ulcer healer in action. It shows least adverse drug reactions even after prolonged administration. Coming to conclusion, Jeerakarishta is mainly given in Pittaja and gastrointestinal tract disorders. There are least adverse drug reactions after administration of Jeerakarishta. It is cost effective, safe and affordable, and palatable also, having sweet smell. And these are the references. So thank you for patient hearing.